Well, my name is Ana Alejandra Ortiz Hernandez. I'm a pediatrician, emergency physician, and I work here in Mexico City in one of the two biggest hospitals just for attention of children, third level hospital, that is named Instituto Nacional de Pediatría. Our hospital has 3,086 beds that for attentions of different patients. And at the emergency room, we see in a year normally 40,000 patients. And now for this COVID pandemic, we are working in a mixed way. We are not just a COVID hospital. We attend patients that has positivity to COVID. And also we attend our patients that has to be attended for the resolution of their normal problems that they have as cancer, immunodeficiency, and metabolic problems. So we are being continued working on in the total of the pandemic with some restriction because we have restrictions at the beginning. Now we are having a new normality that we are trying to adapt and avoid more contagious. But the hospital never stopped to be attending patients, and I think the results of our patients for attention and also for COVID ones, we are having, I think, good results because we have a very good support for the authorities at the hospital all the time.
Can you give us some insight as to when you first noticed more COVID cases in your hospital?
Since we were declared, the pandemic time was beginning here in Mexico, that was in March. Our first patient that we see at the hospital was on April. Even we have time to be prepared for attending the pandemic time. The hospital and I represent the liaison for the pediatric disaster course. That is, this course was created by Dr. Stephen Berman after the earthquake on Haiti. And he saw that the pediatric populations never was considered at the time that a disaster was declared, all the adults. And the patient and the children has special necessities for treatment, for recovery, psychological. So he created a course that has been distributed in different countries. And Mexico, we represent at the National Institute and myself, the liaison for Latin America for the course. So in this course, we knew that we have to be prepared before the disaster is coming, when you have an advance. And this pandemic was the specific example what we will have to do, how to be prepared for attention of the patients. So the hospital prepared in a specific triage area for attending the patients with respiratory disease that could be considered COVID. And also an area for the hospital, the second floor was all totally reconverted to attend patients with COVID positive and also with suspicious of COVID. And also we have the possibility to have a resource for do the PCR and have the results in the few hours, and considers to do the separation of the COVID-1 patients and the patients that were not COVID, were for other viruses, between personnel that was taking care for the children, and also for all the people that has to be involved, because it was the people for cleaning, for the people that give them how to eat, and also for the radiology persons, the people that have respiratory support to the children, and an area that can have the 16 almost beds that can be grown if we needed more. And also an ICU that was prepared with 8 beds with everything that will be needed in case of severe COVID disease with patients that could need it that one. We see the more quantity of patients of May and June, we see a peak with the total of patients, and in July it begins to be going down. And by now at this time, we have not a flat curve, but we have the same amount of patients that we are seeing, just 1 or 2 positive one in a week. It has been less that we see on May, June, and July.
Excellent. Thank you very much. It sounds like your hospital was very well prepared, and I imagine that that it took a lot of coordination between many teams.
One of the challenges we have to do at the hospital is because of the law. It was the declaration by the government that people that could have morbidities and people that could be more than 60 years has to leave. And the hospital is an old hospital. This year, our hospital is his 50th birthday. So we are supposed to have a great celebration now on November. It's not gonna be possible for the pandemic one, but many of the people that work there at the hospital was people that was older than 60 years and have to leave the hospital. So we have to work with less people, nurse team, with attendant team, with people that prepares food. We have to adapt so many things, and we have less than the 40% of the total of the people that work in the hospital during the time we have to attend the pandemic. But we can solve this problem because the people was very support, change this journal of the time. There was people that comes a whole week been working in the hospital and they rest a week too to avoid contagious. So it permits us to be attending the children's and never stop to attend the other disease like cancer, immunodeficiency. We have all the time given the attention to the patients. So emergency room was working in 2 different parts, the normal one and the normal one for attending triage for COVID people. And also the second floor where with the infections team to working with the children's. It's complicated because normally there are people like children like an influenza, for example, that arrive with respiratory distress, are all the time attended at the emergency area. And if they needed something else, can be moved to an area that we had for hospitalization inside the emergency room. This time it has to be moved all this to the second floor with people that maybe don't have the skills to attend this kind of patients, but emergency room at the time it was needed, the people for an ER goes to the second floor to attend the patient, stabilize them, and then goes to the ICU for a specific one. So it has been a very good example of what the team has to do and how with communication and with preparation, we can solve something that could be disaster, a big disaster for the hospital, and it hasn't been of that way at this time.
Wow, so that was a really creative solution. I'm still in shock when I think that you are functioning at 40% capacity, staff capacity.
Yeah, or maybe less, maybe sometimes in a moment, yeah.
Wow, and how about your volume? So if you have 40% less staff, do you feel like the volume in the hospital has dropped a little bit? Has that helped you to be able to take care of the patients, or are you seeing the same volume that you would normally see pre-COVID?
No, the volume of patients was less one. All the surgery that was an emergency one of high priority because can be a compromise of organs of health of the children's were delayed. So it permits us to be working with less surgery time, with less normal consultation for primary care that we see because they don't come. Not even we were close, they don't come, and it helps us too. And also all the different specialties that has to be in contact with the patients, they will be calling them to reagent all the consultation that were programmed for the rest of the years. And if they detect that some children need a special care at the moment, they come to attend them. So we can be, they didn't work there physically, but in some moment if they were needed, they come to attend the patients. Even they were seeing some of the senior attendants that we asked them to don't be in the hospital, they were there sometimes because they said they wanted to be there, but it was a risk. For us, is that La Guardia. At the time it begins 4 p.m., our hospital begins to be more quiet because the total of the consultation is less, and the less of the rest of the hospital is working just with residents. It looks like a day, like a normal ward, because everything was quiet and the people was working all the time. And we have rounds for 8 hours to be in the COVID areas. The people just stay 8 hours, different terms of 8 hours, in the morning, in the afternoon, at night, and they're changing all the time. So it was sometimes a little hard, but the patients don't attend to the hospital because they were afraid. So it permits us to be working with a good way. I think we've done a good job.
So the patients that were afraid to come to the hospital, are you starting to see them coming back now that the numbers are decreasing a little bit and there's more knowledge about good PPE at the hospital and things like that?
Yes, since beginning of September, the city in Mexico, on the whole country, Secretaría de Salud has decided to have a traffic light, red, yellow, and green. And they begins to change this traffic light in the different areas depending of the hospital total patient they could have. So on that way, they begins to open different activities depending of this traffic light. Mexico City, it has been, as you maybe know, or some of you has been here before, Mexico City is a huge city. It's a crazy one. And we have the same amount of population that one part of Italy, the half of Italy. We are here in Mexico City, a total of 28 million people. So it was a challenge to avoid that the hospital could be crowded. So they begins to open different hospitals to provide them from different capacity because they don't have it. The government was helped by a foundation that was Banamex, that is one of the biggest bank in Mexico, and so many foundations, and they opened to an area just for attended COVID patients that could be recovering. And they help to move patients that can be discharged, but needed, for example, just to finish antibiotics or needed some support with oxygen, to keep them in that part and to permit discharge from the biggest hospital, these patients, and have a bed for the other one. But all the time, our curve, as I mentioned before, doesn't have been flat totally. We have been having still now cases, and we continued having mortality. That is the most important cost that we are paying. But we are seeing the same amount of patients in this time that we have seen since August. September has been the same. No a different peak ones. We are expecting to have more troubles now because we are going to enter to the influenza season. But also we have vaccine, and the people has been going to do vaccination that normally they don't do. Now they're taking the shot. So this week in the hospital, we have more than the 50% of the people that has been vaccinated just in a week. So we are expecting to have a good percentage of people that has been on vaccination, and the use of the mask avoid to have so many influenza, and maybe this could help us to be attending COVID patients if we continue in this mood. Since September, after the Independence Day here, that is a huge celebrations, because we were in this traffic light on yellow, they was permitted to have little reunions, but Mexico, it's a country that one of the most important things is to have parties. and to have celebrations. So Independence Day was the perfect moment to have a celebration that we haven't had for so many months. And these last 2 weeks, we have seen a peak of increases on COVID contagious. But if you ask me for the children that arrive to the hospital, it's very impressive to see the children using their masks all the time, and also the covers of the heads with colors, with lions, with frogs, and the children use it. They don't take it away. Sometimes it's more difficult for the parents, but the children keep their mask all the time. And we have a huge bear at the entrance of the hospital, a teddy bear, and the teddy bear has his mask. He's using his mask.
So I just the image of the children with their really cute masks brought the biggest smile to my face. We also have a bear at our hospital, and Dr. Bear has a mask on as well.
Yeah, it's the best. It's the best campaign.
Yes. So how about PPE? Are you experiencing shortages of PPE, or have you been pleasantly surprised?
We used to use PPE for some reason, but we have to train many of the people of the hospital, since people that was making the transportation of the patients, the people that was cleaning the hospital, the people that goes to the feeding of the children's, the people that works in radiology, the people with respiratory areas. So we do a training for PPE all the time. And we have, emergency room and some other area has capacitated more than 300 people at the hospital. And now we are doing and implementing and mobile applications that you can be open and say what part of the hospital you work. And it goes to tell you what PPE is important that you have. For all the people that has been attending patient, it's you have to use, it doesn't matter, your face mask and also this cover mask and goggles or lens if you have lens, glasses. But they have to be used for all the people that could be in touch with patients. The rest of the people can be just using their mask. And this application will help us to teach them, everyone, what exactly they needed, because of the beginning, everyone wanted N95, N95 mask. And we said, you don't need it. You need this one, surgery mask just, but the people was afraid. Now that the people knew at the hospital or learned that the children are not so contagious, and we are not having people that has been contaminated attending patients, the people has been accepted more to use your surgical mask and to try to keep in a better way our N95 mask that we have. So, because we don't have, it's a reality.
Now, since you are an emergency department physician, I just wanted to ask you if you are seeing any trends such as like decreased casualties from, say, motor vehicle accidents, or increased cases of child abuse because people have been at home more than they usually are.
We don't see an increase. That was something that appears not normally, maybe because they don't get them to the hospital. It was the same quantity that we are having. The normal trauma patients that we see, it has been the same in this way. We are beginning to see now an increase because the children are a little more free. We knew that the majority of the injury is in the house. We knew that one, but I don't know, maybe because the mother was more on attending and was more prepared at home, they don't see an increase. We don't see an increase of these ones. And for abuse, maybe there was, but didn't arrive to the hospital. We knew that there was been an increase an abuse of the woman and something like that at home, and it has been reported.
Now, are you guys doing Zoom visits with them, with telemed, like with a camera, or are you calling just by voice to check?
Many of them call them by phone. Many of them use WhatsApp because it depends. Our hospital, we don't have a Medicare as you have in the States. The people that arrive to the hospital is people that they don't have any social service, different ones. So maybe their incoming is not so good. Here in Mexico is something particularly because many people don't have a huge house or car or incoming, but everyone has a phone. And maybe you can see a very good phone once. I don't know how they get it, but they get it. But the connection sometimes is the problem because it depends of the company. I think they don't use so much Zoom for patients. And also our law don't permit to give consultation by this one. There is a hold now on the legal part that how you can treat the patients if you are done seeing the patient and you are not doing a physical exam. So they just given just recommendations and avoid to give consultation. So we have to work with different scenarios. The people that is just coming for attention as appears has been positive, the people that has been in the hospital and begins to having contagion because the parents are all the time traveling and maybe they don't take care or the measures with the masks. So it depends what the scenario we are, and we don't have so many tests. This is the other problem.
So you have to really ration who you use your tests on.
Yes, we do on a specific scale that every day in every area of the hospital is supposed to be done. I'm not so sure that they done it all the days because it's probably not, but they had to ask for fever, cough, dyspnea, respiratory problems to detect people that could have symptoms and take it away. If we detect that in some cases to the consultation that we are having, the normal ones, if we detect at the consultations that the children have symptoms, these children is taken to the triage with their parents. If the parent have symptoms, they can stay at the hospital. We send them to the primary care to be tested. If the children are hospitalized and the parent has symptoms, the parent has to leave the hospital and maybe some other one has to be in touch with the children. So it's sometimes it's difficult because the children has to be, we are expecting to keep them with the parents, but this time this has not been possible. We are trying to diminish as much as possible the people that comes inside a hospital. Just one parent with what children to the consultations, to have areas that could not be so crowded, to ask them to the people to come just with minutes before the consultation, not as used to be that they come earlier to be attended and maybe they were expecting the consultation for 3, 4, 5 hours. Now we are avoiding that one. We take temperature to all the people that comes inside the hospital, and sometimes they don't want it. It has been hard to teach them this new normality, and I think it's the same you live every day in your hospital.
Yes, a lot of similarities there. We have, yes, exactly. We're all experiencing the same thing, just in a slightly different way.
I think that Mexico has been prepared in a different ways. Maybe not all we are happy with the way the pandemic has been controlled, and other ones that are not are happy too. But what we have to understand is, I don't think anyone in the world, anyone, will be prepared to this thing. No, even we have imagined what will means, and in terms of people dying, in terms of people that has been contagious. The only thing that we have to learn is that if we are prepared and we take control before the things happen, we can have maybe better results. In the case of the disasters, we have to learn so much now. As I mentioned before, this course teaches that when we see a disaster, it's a small part, just the point of the iceberg that is down. And this pandemic has teach us that we are never prepared for anything like this, but that we will be prepared as people to help us to be joined, to have empathy for the other one. And if we take care of us, we are going taking care for the rest of the people that could be near me, and learn that our normality will be different since now, maybe for some years, maybe for the rest of life, but we can do a good work if we are prepared, and if we make a collaboration between the countries, between the people, and between our families.
That was beautifully stated. I think that everyone would agree with you.
Yeah.
Thank you.